vision for Craigavon in terms of life science is for this to be a centre of excellence. We have so many great things here already. We have Almac, a leading pharmaceutical company here. We have universities very close by, and we have a college as well that is training people to work for the sector. We also have Craigavon Area Hospital, which is an award-winning hospital, and we just really need to bring everything together, and that's the vision for Craigavon.
I am delighted that the Trust has formed links with Craigavon Borough Council to promote the life sciences in the council area. I'm also very pleased that the Cardiovascular Research Department at Craigavon Area Hospital can be promoted as the main contributor to the life sciences, not only locally but at national and international level, and now is the largest cardiology research centre in Ireland. The research is very ably led by Dr. David McEnany, Director of Cardiovascular Research, assisted by Dr. Ian Manown, Director of Interventional Research, and Dr. Andrew Moriarty, Research Cardiologist. Clinical research nurses are also a vital component of the cardiovascular research team. The clinical scientists in the hospital's main laboratory also have an important role in the research undertaken. The consultant cardiologists participate in many clinical trials and studies, often fulfilling the role of chief investigator for worldwide cardiology studies, each of which would involve upwards of 30 countries and have an overall recruitment target in the region of 20,000 participants. These studies result in the implementation of changes to NICE clinical guidelines, the introduction of new drugs, treatments and coronary stents. The cardiology consultants are also involved in innovative collaborative studies with industry, which includes Randox, HeartSign and Almac. Collaborative work undertaken with the University of Ulster has led to successful joint applications for European funding under the Horizon 2020 programme, a proof of concept application funded by Invest NI, and also reaching one of 10 finalists in the Qualcomm X Prize. It is hoped that through the Council, small to medium-sized enterprises can be involved and contribute to the life sciences economy in the area.
The life science sector is a growing sector and has potential to bring a great number of jobs to this area. We have all the key ingredients, and if we can create a cluster, attract foreign direct investment, grow indigenous companies, we can really make this sector work in terms of employment and future job creation. The relationship is very important to us. At a conference in November, we are signing a memorandum of understanding with the hospital so that industry and the clinicians can work together to promote this area as an area for life science. It's a very important partnership for us, and we've been working very closely with the clinicians to develop a conference and to develop various programs around that too.
Craigavon Cardiac Centre is a busy interventional cardiology setup. We have probably one of the largest lab activities in the country, so we're very busy clinically. We have many patients. Not only do we want to be achieving excellent clinical results, but to drive the profession forward and to improve patient outcomes further, we're keen to participate in clinical research as much as possible. And one of the critical and key aspects of the setup here at Craigavon Cardiac Centre is the fact that the interventional research facility is co-located right next door to the cardiac cath labs. This enables us to have very easy access to our research staff. It enables them to come back and forth to cases to undertake some of the important measurements and help us with the recording of those during cases, and also to document all of the monitoring and the patient follow-up that's required afterwards. The efficiency of the unit allows us to recruit quite highly into clinical trials. This is important for our partners in industry who wish to collaborate with us. So typically we are either top recruiters European global settings, or certainly close to the top in many of the trials that we undertake. We have industry and bioengineering partner collaborations with many companies in the United States, in Europe, in the UK, in Ireland, and also increasingly in some of the Asian markets. And this is despite the fact we're a modest size rather than an enormous cardiac centre, but the efficiency of the setup allows us to do this.